Welcome to UMCC Medical Consultant Connectors. Well, we believe your health truly matters to us, and today we are going to talk about a very popular procedure. Liposuction is a type of cosmetic surgery designed to remove stubborn fat from specific parts of the body. It is not a tool for significant weight loss. Its primary purpose is to shape and contour pockets of fat that persist despite diet and exercise. Doctors use it to create a more defined body outline and enhance natural proportions. Many people consider liposuction for various areas: abdomen, hips, thighs. These areas are often resistant to traditional fat loss. Upper arms, back, buttocks, neck, or chin. The goal: a smoother, more balanced appearance by removing excess fat deposits. It can boost confidence for those who've long struggled with problem spots, helping them feel more comfortable in their own skin. Liposuction uses a specialized tool to remove fat cells beneath the skin. A thin, hollow tube, the cannula, is inserted through tiny incisions. The surgeon moves the cannula back and forth to break up fat tissue. Once loosened, fat is suctioned out with a medical vacuum, or with a syringe attached to the cannula. The procedure requires high skill and artistry to achieve smooth results. Natural-looking, symmetrical outcomes are the aim, avoiding lumps or divots. Have realistic expectations about what liposuction can and cannot do. It improves contour but won't change your fundamental body type. Results are long-lasting only if a healthy lifestyle is maintained. Significant weight gain afterward can enlarge remaining fat cells. Maintaining a stable weight is key to preserving your sculpted shape. An illustration often shows common areas for liposuction: abdomen, thighs, and arms. So, who is the right person to consider undergoing liposuction? The ideal candidates are typically individuals who are in good overall health and have maintained a stable body weight for some time. These are people who are already close to their ideal weight, but are bothered by specific, localized pockets of fat that seem resistant to all their efforts with diet and exercise. They are looking for a refinement of their body shape rather than a drastic transformation or a solution for obesity. A positive outlook and clear, realistic goals are also incredibly important attributes for any potential patient. Another key factor for a successful outcome is having good skin elasticity. Skin that is firm and elastic will be able to retract and conform smoothly to the new, reduced body contours after the fat has been removed. Your final look should appear natural and balanced. Just as there are ideal candidates for liposuction, there are also individuals for whom the procedure is not recommended and could be dangerous. People with significant chronic health problems should generally avoid this elective surgery. This includes those suffering from serious heart conditions, uncontrolled diabetes diseases that compromise the immune system. Any condition that impairs the body's ability to heal or increases the risk of complications during anesthesia or surgery is a major red flag. A thorough medical evaluation by a surgeon is necessary to identify any such underlying health issues before even considering the procedure. Individuals with a history of blood clotting disorders, such as deep vein thrombosis, pulmonary embolism, are also at a much higher risk and may not be suitable candidates. Surgery of any kind inherently increases the risk of blood clots, and for someone with a pre-existing tendency for clotting, this risk becomes unacceptably high. Similarly, people who are taking certain medications, like blood thinners, that cannot be safely stopped for the surgical period should not undergo liposuction. Patient safety is the absolute top priority. Furthermore, liposuction should not be performed on pregnant women. The procedure and the anesthesia involved pose potential risks to the developing fetus. It is always advised to wait until well after childbirth and after the body has had time to recover and stabilize before considering any cosmetic surgery. Additionally, individuals who have unrealistic expectations about the outcome are not good candidates. Someone who believes liposuction will solve all their body image issues, fix their personal life, or result in dramatic, effortless weight loss will inevitably be disappointed. Mental and emotional stability are just as important as physical health. Lastly, those with very poor skin quality or significant amounts of loose hanging skin are not well suited for liposuction alone. Removing the underlying fat from these areas without addressing the excess skin will only worsen the appearance of sagging. These individuals would likely achieve a much better result with an excisional procedure, abdominoplasty, tummy tuck, brachioplasty, arm lift, which are specifically designed to remove both excess fat and skin. Choosing the right procedure for the right problem is the cornerstone of achieving a satisfactory and beautiful cosmetic outcome. Results should be tailored to you. The liposuction procedure begins long before you enter the operating room. It starts with a detailed consultation. Your surgeon will carefully evaluate your overall health and medical history. They will physically examine the areas you wish to have treated and discuss your aesthetic goals in detail. This is the time when the surgeon will mark the specific areas on your body that will be sculpted. Preoperative instructions are given, stopping certain medications, getting lab tests done. On the day of the surgery, you will arrive at the surgical facility, and these markings will be confirmed once more before the process starts. Once you are in the operating room, the first step is the administration of anesthesia to ensure you are comfortable and pain-free. Depending on the extent of the procedure and the areas being treated, this could be local anesthesia, which numbs only the targeted part of your body while you remain awake, or general anesthesia, which puts you completely to sleep. The surgical area is then thoroughly cleaned with an antiseptic solution to minimize the risk of infection. Your safety and comfort are monitored continuously throughout the entire procedure. The core of the operation involves the surgeon making several very small, discrete incisions in the skin near the fatty deposits. These cuts are typically only a few millimeters long, just large enough to allow the insertion of the cannula. Next, a special sterile fluid, known as tumescent solution, is often injected into the area. This fluid contains a local anesthetic to reduce pain and a medication called epinephrine to constrict blood vessels, which significantly reduces bleeding and bruising. This step makes the fat easier to remove and enhances the safety of the procedure, a technique known as tumescent liposuction. With the area prepared, the surgeon inserts the cannula through the incisions and begins the fat removal process. They use controlled, deliberate back-and-forth motions to break up the fat cells, or fanning motions to break up the fat cells. These fat cells are then suctioned out of the body. Power-assisted liposuction uses a vibrating cannula to work faster. Ultrasound-assisted liposuction uses sound waves to liquefy fat in fibrous areas. Laser-assisted liposuction employs laser energy to melt fat. Water-assisted liposuction uses a gentle water jet. Once the desired contour is achieved, the small incisions may be closed with a stitch or left open to drain, and the area is bandaged. After the surgery is complete, the recovery process begins. You will be fitted with a special compression garment over the treated areas. This garment is crucial for minimizing swelling. It helps by reducing bruising, and it helps your skin conform to your body's new, slimmer shape. You will need to rest. Avoid any strenuous activity for a few weeks, as directed by your surgeon. Some pain is normal, swelling is normal, and bruising is normal. Your doctor may provide pain medication to keep you comfortable during the initial days. The final, beautiful results will gradually emerge as the swelling subsides over the following weeks and months. While liposuction is generally safe, it is still a surgical procedure and carries potential risks. The most common issues are temporary: bruising, swelling, and numbness in the treated area. More serious, though less common, risks include infection, uneven or wavy skin contours, and changes in skin sensation. Very rare, but life-threatening complications can include blood clots forming in the legs, a fat embolism, where fat gets into the bloodstream, or fluid imbalances, especially when very large volumes of fat are removed. Puncture injuries to internal organs are also an exceedingly rare but possible risk if the cannula is not used with expertise. So, how can you ensure your safety? The single most important step you can take is to choose a qualified surgeon. Choose an experienced surgeon. Choose a board-certified plastic surgeon. Do your homework. Ask about their specific experience with the liposuction technique you are considering. You should also have a complete health evaluation before surgery to make sure you are a good candidate. It is vital to follow all of your surgeon's preoperative instructions. This includes quitting smoking well in advance. Arrange for a friend or family member to help you during the first few days of your recovery. Ultimately, liposuction can provide wonderful, confidence-boosting changes for the right person. It is most effective for individuals who are near their ideal weight and for those looking to sculpt specific areas, not as a quick fix for weight loss. It is a serious decision that involves both benefits and risks. We encourage you to have an open, honest conversation with a trusted, board-certified surgeon and ask plenty of questions. Thoughtful planning leads to better outcomes. Every body is different. Plans are customized. Goal: natural proportional results. Results vary by individual, technique, and healing. Thank you for tuning into UMCC Medical Consultant Connectors, where your health will always matter to us. Please like, please subscribe, and please share this information by clicking the buttons below.